This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famiyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Hello, this is Dr. Famiyiwa. So today I'm going to talk a little bit about polycystic ovarian syndrome on Fertile Talks. And the reason I'm talking about it today is because a lot of my patients have just asked me to re-explain certain points that they weren't clear on. Maybe they were newly diagnosed with polycystic ovary syndrome, or they've been struggling with it, trying to cope for a long time. So polycystic ovary syndrome is a hormonal disorder that affects approximately 1 in 10 women of reproductive age, and it's usually associated with infertility. Right? It affects several aspects of a woman's life, and it affects a woman's metabolism as well as her mental health, mental well-being. Um, so, what is polycystic syndrome? At its core, polycystic ovary syndrome, shortened as PCOS, is a disorder really of your hormones, a disorder of the endocrine system, which is responsible for regulating hormones. Women with PCOS tend to have higher levels of male hormones known as androgens. This hormonal imbalance interferes with normal ovarian function and leads to issues like irregular cycles, the development of ovarian cysts, and in some cases, infertility. So one of the key characteristics of PCOS is the presence of multiple cysts in the ovaries, which are really essentially immature eggs that have not fully developed or have been released during ovulation. However, not all the women who have PCOS have ovarian cysts, and having ovarian cysts does not automatically mean that you have polycystic ovary syndrome, right? So it just underscores the fact that there is a complexity of diagnosing and understanding this condition. What are the causes of polycystic ovary syndrome? The exact cause remains unknown, but it's usually a combination of both your genetics and environmental causes, as well as lifestyle factors contributing to it. We do know that polycystic ovary syndrome tends to run in families, and so it suggests that there is a strong genetic factor with PCOS. So, for instance, you might have a mother or a sister who have PCOS. If you do, then you have a higher risk of developing it. We do know that insulin resistance also plays a significant role in polycystic ovary syndrome. So many women who have polycystic ovary syndrome have higher levels of insulin, which can drive the ovaries to produce more androgens. So this excess insulin can lead to weight gain, further making the issue worse, right? Lifestyle factors such as a poor diet and lack of exercise can make it worse. They can worsen the insulin resistance, but they're not necessarily the cause of polycystic ovary syndrome. Inflammation is another key player with PCOS. You have a low grade inflammatory state, right? So, low grade inflammation has been observed in women with PCOS, which may trigger the ovaries to produce more androgens. So, it becomes a vicious cycle, right? So, this systemic inflammation is thought to be connected to both insulin resistance and the metabolic issues that are often seen with PCOS, such as high cholesterol, high blood pressure, and increased type 2 diabetes. All right. So, what are the symptoms of polycystic ovary syndrome? What symptoms would you expect? The most common one you might see is irregular menstrual cycles. And this is usually just the first sign that something may be wrong. So, women with PCOS may experiencing frequent or absent periods or periods that are unusually heavy. Another symptoms, patients with PCOS may have excessively high levels of androgens. Androgens are the male hormones produced either, and they may have it either being produced by the ovaries or the adrenal glands. Well, if you have very high levels of androgens, some of the symptoms you might see include hirsutism. Hirsutism is having excessive hair growth on the face, on the chest, on the back. Acne could be a symptom of excess androgen hair levels. And then sort of male pattern baldness, thinning hair on the scalp. Again, you might see that the ovaries have sort of a very high density of cysts. Be clear, the ovarian picture is not by itself diagnostic. You have to have that as well as other factors such as the evidence of high androgen levels or either in the blood or symptoms of high androgen levels. One of the other symptoms patients may have is weight gain and or difficulty losing weight. So you might find that PCOS patients struggle with their weight, and particularly the centripetal, we call it centripetal obesity, which is the weight that you gain around your abdomen as opposed to the pear-shaped weight, which is usually around your thighs. So the abdominal weight gain is the one we fear the most because that has been linked to the so-called metabolic syndrome, giving you higher risk of other things such as heart attack, or heart disease, or disorders of atherosclerosis and such. Now, insulin resistance can also be a symptom of PCOS. So patients may have sugar cravings, fatigue, difficulty managing their blood levels. Um, Sometimes you might see skin changes. There's one particularly called acanthosis nigricans, which is darkening of the skin, particularly around the neck area, the armpits, the groin. And this can be actually a sign of insulin resistance. Um, so, another thing is because of the physical symptoms of PCOS, there can be a profound impact on the women's mental health. So, a lot of patients with PCOS may experience anxiety, depression, and body images issue. So, it takes a toll on emotional well being. So, how would you diagnose it, PCO? PCO is usually a multifactorial diagnosis, right? I hinted at this. One of the criteria used commonly is the so-called Rotterdam criteria, which means that a PCO patient must meet two of the following three criteria. Number one, irregular or absent ovulation. And this may manifest as irregular menstrual cycles, right? Excess androgens manifesting as elevated male hormones, either detected by blood test or visible symptoms of excess androgens, such as male pattern baldness or excess facial hair or acne. And then the polycystic ovarian picture on the ovary. So any two combinations of this may will give you meet that criteria. So typically, we would perform certain blood tests to measure your hormone levels. I like to also add in a fasting insulin and glucose. I also like to check a hemoglobin A1C because we do know that you're a high risk for diabetes and insulin resistance. And I get a comprehensive metabolic profile to see what else is going on, your androgens, your liver enzymes, and I do a thyroid panel as well. I do look at some of the adrenal hormones produced because we do know that if you have adrenal hyperplasia, you will produce excess androgens as well. So that can be one of the lookalikes, right? It'll present a lookalike picture of PCO. So we want to rule that out. Now, how do you manage PCO? I think PCO has to be managed more of a holistic approach, right? So we always start with your diet, and of course, exercise as being some of the first line treatment. You got to move around. Reducing body weight by even 5 to 10% may help regulate the menstrual cycle and improve insulin sensitivity in some patients. So you want a diet rich in whole foods, lean proteins, healthy fats, and low in refined sugars, which only aggravate the insulin resistance. So you want to avoid refined sugar. Move your body, exercise a little bit, go for a walk. Walking is the you have the least impact. Now, if you swim, that's even great. You can go swimming. I had a patient who enrolled in a swimming class, water aerobics they called it, and within 2 months I didn't recognize her again. So incorporating some form of regular physical activity would help. Whatever suits you. You have to do something that suits you so that you can maintain it, right? So, don't go, try out for the Olympics trying to hit the gym. You won't sustain it. Medications. What can we do? Metformin is a drug typically used to treat type 2 diabetes, but is also effective in managing insulin resistance in patients with polycystic ovary syndrome. For patients who are not trying to conceive but have excess androgens and irregular cycles, they may be placed on birth control pills because you'll get a 2-for-1 effect. You'll regulate your bleeding and you'll also lower your androgen levels. Nowadays, patients can use the new medications like Mounjaro or Ozempic, which will also help with insulin resistance and weight loss. So that's coming into play as well. You can consider for those trying to conceive medications such as Clomid. However, newer studies are showing that letrozole, also known as Femara, is probably the ideal drug that we might start with for women trying to conceive. And if that doesn't work, then you can progress on to injectable medications. What are the supplements that you can use? Supplements such as inositol, which is a type of B vitamin, has been shown to improve insulin sensitivity and to help reduce androgen levels. Omega-3 fatty acids and vitamin D may also help to reduce the inflammation that you see with polycystic ovary syndrome and sort of support a good metabolic health in women with PCO. Long-term considerations for PCO. Long term, we always fear type 2 diabetes. So you're at risk. It doesn't mean that you will get it. But if you start making changes now, you can avoid it. So insulin resistance in women with PCO puts you at a 4 times likelihood of developing type 2 diabetes. Cardiovascular disease. PCOS increases the risk of heart disease, and this is due to the associated obesity, the high blood pressure, the high cholesterol that we mentioned. Endometrial cancer. If you're not regularly shedding your lining, then the lining builds up. You're at increased risk for endometrial hyperplasia. So I always panic when someone tells me they haven't had a period in 2 years and I do an ultrasound and the lining is so thick I could see it and it has a mottled complex appearance. So the first thing I want to do is I want to get a tissue diagnosis to make sure they don't have hyperplasia or they don't have early cancer. I can't tell you how many patients I've seen where I have diagnosed precancerous lesions. Now we have to stop the show, stop everything we're doing, because that needs to be treated. When someone has hyperplasia, especially the hyperplasia that has a tibia in it, that's precancerous and that needs to be treated. And once they conceive, the GYN oncologist may actually recommend, after they've completed their family, that they need to get a hysterectomy to prevent them from getting endometrial cancer. So that is a big issue that I deal with when patients come to see me. My antennas are high. I'm looking at that and I'm immediate concern for we need to treat this as soon as possible before even talking about trying to get pregnant. Other things that may be a health consideration is depression and anxiety. So there are a lot of mental health struggles common in women with PCO, both due to the hormonal imbalances as well as the emotional toll of managing the condition. So we do have support here. We have counselors, we have support groups, and we have a counseling service right practically next door, actually. And I think it's important to utilize those facilities to help you on your journey and to know that you're not alone, and there are people here to help you, and there are resources that can also help you. So key thing is when you're living with PCO, it can be a lifelong thing where you have to manage it, right? You can't just let it run rampant, but do know that you don't have to go through it alone. There are now support groups online and in person where you get provided a sense of community, of connection, and working closely with a healthcare provider in a holistic fashion. So I use counselors, I use psychiatrists for my patients who struggle with anxiety. I use dietitians, I use nutritionists. You can even consider getting a health coach, do some sort of health regimen that works for you. So I think the best treatment is more like a comprehensive, holistic approach, and make patients feel safe. Let them know they're not alone. So, in conclusion, I think there's a lot of hope for managing PCOS, right? It's a complex and multifaceted condition, and it is completely manageable with the right approach, from lifestyle changes to medical treatments. There are many strategies to help women manage their symptoms and improve their overall health. So, if you suspect you have polycystic ovary syndrome or you have been recently diagnosed, remember that early intervention and a personalized treatment plan can make all the difference. Please talk to your doctors, explore your options, and know that with the right care, it is possible to live a full and healthy life with PCO. So I do hope that you've gained something from this episode. If you have, please subscribe, like us, and please share. If you know someone who you think has the symptoms that I've described so far, please share this episode with them and give someone else. Let's spread the hope that they're not alone. Thank you once again. This is Dr. Famiwa. Love you. This is my labor of love. Thank you. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famiwa.